Hey, good evening, everyone, and welcome to your favorite show, Ask Dr. Saw. I cannot say how pleased myself and Dr. Saw are by the response that we've been getting from everyone, and it's so wonderful to have so many people coming on board with the show and sending in the questions and engaging, especially. I love the engagement, and I know we have some really good fans who've been following us on the show, and they're really being part of this unique presentation of information from a medical perspective by none other than Dr. Saw himself. Dr. Saw, how are you doing?
I'm fine, thank you. And you?
Very well, thanks. Still a little bit of the cough, but yeah, it's going away. It's going away. Yeah, it's a little nagging at times, but I think I haven't done my part also to ensure I keep drinking a lot of cold things and so on too. So that doesn't help the situation. But is that a myth? But before we start the show tonight, is that a myth or is it really? You got a cold, you got a flu. Does drinking cold things make it worse? Could it prolong it?
Sure. No, that is true to an extent. And the reason is there are some microorganisms in your body that they strive or they multiply in that type of environment. In moist, humid environment, you can have a multiplication of microorganisms. So when the place is cold, when your body temperature is cold, when you're in that state, possibly, you can have multiplication of the germ and it can prolong it. So there's some theoretical science in that.
Wonderful. Dr. Saw, tonight we're talking about a very important topic, urinary tract infection, UTIs. And, it's a lot of from last week, many of the questions were coming in last week because of what we were dealing with were to do with UTIs also. So I'm happy that we're having this conversation tonight. I'm happy that we are going to bring this to the fore. And Dr. Saw, I would start off by asking you, first and foremost, what is a UTI? And as a follow-up, why is it that it seems that more women are susceptible to this to UTIs and not so much men?
Yeah, that's a good question, and I'll get to that. I thought that today's topic would be a follow-through from last week's topic, and it will allow us that smooth flow, because we didn't get to cover lots of things. Half an hour sometimes is a little bit too short, because we can end up talking for hours.
Yeah.
Hours.
Time goes by.
But yes, coming back to UTI. So UTI is, by definition, urinary tract infection. And what it is, it's an infection of the urinary tract. And as I explained in the past, the urinary tract comprises of the kidney, and so you have two kidneys at the top by your back that goes down into your abdomen, the tubes, and then it leads to the bladder. So the kidney, those two kidneys, blood flows into the kidney, then it leads down into two tracts they call ureter, and that connected to the bladder, which is like a reservoir, and it leads out to the urethra.
Urethra, yes.
And that's what you pee or you pass urine through. Now, anyway along that route, if you have infection, an infection is microorganisms. So these are bugs, right? And you can have bugs. Bugs are divided into different types. You have bacteria, you have viruses, you have parasites, you have fungus, there are different types of microorganisms, and they all can cause infection. Now, it is also extended in men. Urinary tract infection, we can also categorize something called prostatitis. So the prostate, which is the outlet of the bladder, you have a walnut-shaped organ, which is called the prostate, and it can get infected, and that can comprise part of UTI. And as you go down to the testicle, epididymis, which is the tubes that store the sperm, you can have infection there that are linked to urinary tract infection in men. So men can have a little extension of urinary tract infection that can involve the prostate and the epididymis. That's the testicle. Good. So we've got the definition as to where the urinary infection is and what causes it is growth of microorganism. And they're common microorganisms. So the second part of your question, you asked, why is it more common in women? Now, if we look at the way urinary tract infection is caused, or the majority of causes, is due to what we call ascending infection. So infection moves from the perineum area. So the perineum area is the area around the anus and the vagina.
Right. That's space. Yeah.
Yeah, that little part there. So there are bacteria around there. So there, as you know, there are lots of bacteria in our skin and generally in our body. And the bacteria there, it ascends, as in it moves up the urinary tract. Now, why women get it? Men urinary tract leads into the penis, and it's a long tube.
Right.
Whereas women, it's a small, short tube from where their outlet is, where they pass the urine, to the bladder is a very short tube. And because it is easier for you to have ascending infection, that's why it's more common in women. And secondly, you have the perineum, the opening opens in the vagina, and that area which is more exposed in many ways to the rest of the body. So you have a likelihood of anal and perianal and perineal infection ascending upward. So that's a common cause, and I suppose there are probably other genetic predisposition, the anatomy of the body. Women also tend to, and one of the risk factors, I'll talk about that, stagnation of urine. Women, we can go and pass urine anywhere.
Right.
Stop out of the street and you can do that.
I don't recommend it. I don't recommend it. It's a very it's not a pleasant sight to see, man. But you know what? Sometimes we just can't make it. We just can't make it anymore. I understand.
Women generally they hold the urine more.
Yeah.
For bladder bursting to go, and they have to wait until they get home or
they can't go being a lantern post.
And that is a predisposition, because when you have urinary stasis, so you have urine build up in the bladder, the bulk stays for longer and they multiply more, and you can have more risk of urinary tract infection. There are other risk factors. Generally, pregnancy is a risk factor. So, woman gets pregnant, so generally diabetes as a risk factor, and certain immune suppressed condition. If you're, weaker, your body system is weaker, you get that. And patients who are born, there's some people who are born with malformation of the urinary tract. So you have a double opening of the, where you pass urine, or you have duplication of the urethra.
Right,
there are some malformation generally predispose you to it.
Yeah.
And patients with kidney stones, that's another risk factor.
Yes.
So these are called risk factors of urinary tract infection.
Yeah. But Doc, I know somebody who had a woman, of course, who had a UTI, and I can tell you that it was very, it was very painful for her. What are some of the symptoms that accompanies a UTI?
Right, fine. So we talk about symptoms.
And what are some of the flagship, the red flags that we need to, as soon as you see those things, you need to get on the ball.
Fine. So generally, it has to do with how bad the urinary tract infection is, right? So I have seen patients with mild symptoms. They just say, Doc, I feel a discomfort down below, or discomfort at the abdomen. And when you test them, that's a urinary tract infection. Now, if the infection stays and it gets more progressive, then of course you have other symptoms. But let's start with the basics. The basic, you would have symptoms of what we call dysuria. So dysuria means painful or discomfort in passing urine. So when you go to pass urine, you feel a stinging sensation, a burning sensation, or some form of discomfort, and that is called dysuria. Now, you can also have incontinence. So normally, yes, when you want to pass urine, you can make it in the toilet. Some patients, they just get incontinent. They can't pass urine. Or they pass too much urine. You can also have retention, where you can't pass urine.
Right.
So you have retention, you have incontinence, then you have frequency. So let's say you're going once a day or twice, well, not more than that, you generally go, but let's say you're going 4 times a day, you may end up going 4 times an hour. So that's called frequency. So you have increased frequency, you can have plus or minus incontinence, you have dysuria, that is discomfort, then you may have abdominal pain, so lower tummy pain in your where your bladder region is, the pubic area. You have pains there, and that can give rise to it. You may see blood in the urine. Hematuria, we talked about blood last week, which can be a sign of urinary tract infection. Patients and children especially, they can have, and elderly patients, they can have bedwetting. So suddenly they wet their bed, and that may be a sign of urinary tract infection. Your urine may be smelly, and that is a giveaway as well, a sign of urinary tract infection. Now, as the infection progresses and it go higher, it can get into the kidneys. You have back pain. So instead of tummy, you have back pain. And if the infection progresses so badly that it gets into the blood system and you become septic, it can give rise to serious illness where you're hospitalized, you're actually generally weak, you have high temperature, you shiver, so rigors, fever, temperature, and it drops your blood pressure. So urinary tract infection can lead to sepsis, which can be fatal if it's not treated in time. You heard of sepsis when
yes,
there
of
is
course.
bacteria
Yeah.
in the blood.
In the blood, yeah.
Now, it is not a trivial condition. As a matter of fact, they said the second most common cause for antibiotic request in a doctor's surgery is for urinary tract infection. The first cause is upper respiratory tract infection. That's your sore throat and your cough and cold and chest infection. And the second most common cause for antibiotic request is urinary tract infection.
Wow.
So it's a very common condition that we see, and most women would have urinary tract infection at some point. And then there are other types of urinary tract infection. So you have what we call a recurrent urinary tract infection. I'll come to that in a minute. But that's your sign and symptom.
Right. So if a patient, if somebody is suspects that they have this and they're at home, they're not close to a doctor at that point in time, are there any further investigations or any method that they can use at home to determine whether this is or not?
Correct. Yes, indeed. So we have specific tests that you can do to establish objectively that you have a urinary tract infection. They have just published some new guidelines on urinary tract infection, however, and the guidelines stated that if patients are symptomatic, that is about enough evidence to say they have UTI.
Right.
Because I will go through the different tests, and some of the tests are not they are not sensitive enough to tell you 100% that you have urinary tract infection. So a giveaway would be morning sensation or discomfort, urinary frequency, and smelly urine. You can say, fine, he's got all the classical signs and symptoms, abdominal pain. I would treat blindly without testing. Because if I were to test and that test is negative, it can still be a urinary tract infection.
Okay.
So no test is 100%. To put it that way. So we better to treat than not to treat. But I will tell you some of the tests that we do. So you see the doctor can take a sample of urine and they dip it into they tell you, give you a bottle, pass some urine in it, and they have a strip where they dip the urine into the strip and they have a look at it. So what we're looking for white blood cell. So on the strip, it's got different colors.
Right.
And when you look at the color changes. Let's say from red to green or red, blue, green, whatever. So the color change will tell you if it is positive or negative to what you're looking for. So in UTI, we look for we look for white blood cell in the urine. So leukocytes, you will see it says positive or negative or plus. That's a sign, that's a giveaway. And the sensitivity of leukocyte is about 80%. So 80%, if you dip that, you could say fine. Of all the positive people, 80% would show up. You can miss 20%. So that is called a sensitivity of a test.
Right.
So
right.
not because if that is negative, it means you don't have it. Remember, it picks up 80% of the positive people. So we would say, fine, that's a clear-cut urinary tract infection. Nitrites, you have something called nitrites, also on the strip that you look at, and the nitrites has got a sensitivity about 50%. So you can miss 50% of people. So half the people, and that is why I said there is a limitation to the dipstick test. So
Right.
not because you go to the doctor and the doctor dip the test next to you and say, fine, this thing is positive or it's negative. You have to know the different parameters and how sensitive they are to pick up 100. So that's not 100%. So what we will do